It's amazing to think our hearts just keep going, you know? Over 100,000 beats a day, every day, and they change so much over time.
Yeah, it's incredible.
And that's actually what we're diving into today, how our hearts age,
Right.
and so
Yeah.
how we can help them stay healthy as we do.
Sounds good.
We're using an article from the National Institute on Aging called Heart Health and Aging.
Right.
And we'll cover some interesting stuff like why a slightly irregular heartbeat can
Mm.
actually be normal as we get older.
Interesting.
And of course, we'll share tips for keeping your ticker in top shape.
I'm happy to share my expertise on that.
Perfect. Before we get into the aging process, I think it'd be good to
Yeah.
quickly recap how the heart works.
Yeah.
I mean, I know it pumps blood, but
Of course, yeah.
could you give us like the Spark Notes version?
Absolutely. So think of your heart as a powerful pump, okay?
Okay.
4 chambers, 2 on each side.
Got it.
The right side pumps blood to the lungs, picks up oxygen.
Right.
The left side then sends that oxygen-rich blood to the rest of the body.
Makes sense.
And it's all controlled by the heart's electrical system.
Oh, right.
It's like the heart's own little pacemaker, keeping everything in sync.
That's helpful. Yeah, like a little conductor.
Exactly.
So then what happens to this incredible pump as we age?
Well, one of the first things is your heart rate during activity like exercise or if you're stressed, it actually decreases.
Oh, really? So it doesn't beat as fast?
Exactly. It slows down a bit.
Huh. So does that mean I'm getting less fit?
Not at all. Your resting heart rate,
Yeah.
the beats per minute when you're relaxed,
Right.
that stays pretty much the same throughout a healthy lifespan.
Oh, that's good to know. But what about, I've heard that the heart can actually get bigger as we age.
Yeah, you're right. The chambers of the heart can enlarge,
Really?
and the walls of those chambers thicken.
So it just gets like bigger all around.
You'd think so, but that thickening can actually reduce the amount of blood it can hold.
Wait, really?
Yeah, so even though the overall size might be bigger, there's less space inside for blood.
So like a bigger container, but thicker walls?
Exactly.
So less room for the blood.
Yep. And that thickening can also increase the risk of atrial fibrillation,
Oh, I've heard of that.
which is basically an irregular, often rapid heartbeat, and that can lead to more complications.
Okay, so that's something to watch out for.
Definitely.
What about the valves? I hear about those a lot. Do they change too?
They do. The valves which control blood flow between the heart chambers,
Right.
they can actually stiffen with age.
Stiffen.
Yeah, imagine a door hinge that gets rusty, you know?
Oh, yeah.
It doesn't open and close as smoothly.
Ouch. That doesn't sound good.
It can make it harder for the heart to pump blood efficiently.
And what happens then?
Well, you can get a buildup of fluid in the lungs or even the legs and feet.
Okay, so we've got a heart that might not beat as fast under stress,
Uh-huh.
chambers that get bigger but with less space,
Right.
and valves that stiffen up.
Yeah.
I'm guessing this is all connected to that increased risk of heart disease.
You're exactly right. Some changes are just a natural part of aging,
Right.
but they can increase the risk of various types of heart disease.
Okay, well, that's a perfect transition into our next section.
Let's get into it.
So let's dive into those different types of heart disease.
All right.
So let's dive into those different types of heart disease.
All right, let's start with arteriosclerosis,
Okay.
which is basically hardening of the arteries.
Oh, yeah, like old pipes in a house.
Exactly. They get clogged up over time.
And that's connected to high blood pressure, right?
Yeah, high blood pressure is a big factor.
Which I know becomes more common as we age.
Absolutely. It puts extra strain on those artery walls.
So it makes them harden faster.
Exactly.
Okay, so then what about atherosclerosis? I always get those two mixed up.
Atherosclerosis is a little more complex.
Oh, okay.
It's the buildup of fatty plaques in the artery walls.
So like in addition to the hardening?
Yeah. Think of it like this. The pipes are stiff,
Right.
but now they've also got gunk stuck to the inside.
Oh, so they're narrowing too.
Yeah, so it's harder for blood to flow through.
A double whammy.
Exactly. And it's not just a normal part of aging.
Oh, really?
It's a disease process that can actually affect arteries throughout the body.
Wait, so not just the heart?
Nope. Any artery.
So like what if it's in your leg?
Well, if it's in the artery supplying the brain, it can lead to a stroke.
Oh, wow.
So it's really important for overall cardiovascular health.
That makes sense. So keeping those arteries clear is important.
Very important.
Now, what about when those plaques rupture?
You're right to be concerned about that.
Yeah, I've heard that's when things get really serious.
It can be, because when a plaque ruptures, it can trigger a blood clot,
Okay.
which can then completely block blood flow.
And if that happens in the heart?
That's a heart attack.
Okay, so arteriosclerosis, atherosclerosis, what else is there?
Well, we should talk about angina.
Angina.
Angina is chest pain or discomfort that happens when the heart muscle isn't getting enough blood.
So like a warning sign.
Exactly. Could be a sign of potential heart attack.
And everyone always talks about chest pain.
Well, the pain can actually radiate,
Alleviate.
yeah, to the arms, neck, jaw, so it can be tough to pinpoint.
So any pain in those areas could be a sign.
It could be, yeah.
So if we have any chest pain, we go straight to the doctor.
Well, if it's sudden, especially with shortness of breath, nausea, cold sweats,
Okay.
call 911, don't wait.
Better safe than sorry.
Exactly.
But what about those early warning signs?
That's the tricky thing about heart disease.
What is?
It can be very sneaky.
Sneaky how?
You might not have any noticeable symptoms at all
Until it's too late.
until something serious happens, yeah.
So how do we catch it early then?
Regular checkups are key.
Okay.
Your doctor will usually check your blood pressure
Right.
and order a blood test for cholesterol.
Makes sense.
Those are good basic screenings.
But what about more in-depth tests?
If your doctor thinks it's necessary, based on symptoms or risk factors,
Okay.
they might recommend more tests, like an electrocardiogram.
An ECG?
Yeah, or ECG.
Yeah.
It measures the heart's electrical activity.
Interesting.
A chest x-ray can show if the heart is enlarged.
Or fluid buildup, right?
Exactly.
Anything else?
There's also echocardiograms, which use sound waves to create images of the heart.
Really?
Yeah, it shows
Yeah.
how it's functioning,
So they can actually see the heart beating?
pretty much.
That's wild. And I guess blood tests can show things too.
Oh yeah, they can check for markers of heart disease or inflammation.
Wow. So we've covered a lot about heart disease.
We have.
But I think we need to talk about heart failure specifically.
Okay.
Because I think a lot of people hear that and think it means that their heart just stops.
Right. But it doesn't mean the heart stops working completely.
Okay.
It just means it's not pumping as efficiently as it should,
So it's weaker.
like a car engine losing power.
I see. And what causes that?
Well, sometimes it's damage from other conditions, like coronary artery disease
Right.
or diabetes.
Or just wear and tear over time.
It can be. The heart muscle can weaken.
Now, I've heard that high blood pressure and obesity can really increase the risk of heart failure.
Especially in older adults. Yeah.
Why is that?
Well, think about it. Long-term high blood pressure,
Uh-huh.
it makes the heart muscle thicker and stiffer.
Oh, right.
So it's harder for it to relax and fill with blood.
I never thought about that.
It's like trying to inflate a balloon that's already partially full of sand.
Uh-huh. I like that analogy.
It takes more effort and it doesn't expand as much.
That makes sense. So all of this sounds pretty serious.
Yeah, it's definitely something to be aware of.
But I'm hoping there are things we can do to protect our hearts even as we age.
Absolutely, there's a lot you can do.
Oh,
Actually, that's what I find most encouraging about this whole topic.
what is?
We have way more control than we think.
So we've talked a lot about taking care of our hearts today, but what about like the future of heart health? What's coming next?
That's what I find so fascinating. The research is constantly evolving.
Yeah.
Scientists are making some incredible strides in understanding the aging heart.
So what are they looking at right now? Like what gives you hope?
Well, one thing that has everyone excited is personalized medicine.
Personalized medicine.
Imagine your doctor could tailor treatments and prevention strategies
Uh-huh.
based on your genes and your lifestyle.
Wow. So it's not one size fits all.
Not at all. It's like custom-made heart health.
That's amazing. What else is there?
Well, they're also developing new drug therapies and even gene therapies
Really?
that could actually target those cellular changes that come with aging.
So not just managing symptoms, but actually like slowing down or even reversing the damage.
It's a real possibility, and researchers are really digging into it.
Wow.
But here's what I find even more interesting.
Okay.
The lifestyle choices we talked about.
Yeah, exercise, diet, all that.
All of it, those actually impact the aging process at a cellular level.
So it's not just about feeling good today. It's about keeping our hearts young for longer.
Exactly. We have more power over our heart health than we think.
That's really empowering to hear.
It is. Knowledge is power.
Right.
When we understand how our hearts age, we can make better choices,
Absolutely.
brief and healthy. So to wrap up our deep dive,
Yeah.
we talked about how the heart works, the changes that come with age, and things that can go wrong.
Right.
But we also learned that there's so much we can do to protect our hearts.
We really do.
And the future of heart health is looking pretty bright.
Very bright.
It's a lot to take in,
Yes,
but
it is.
I think the biggest takeaway is that knowledge is empowering.
I completely agree.
Understanding how our hearts age gives us the power to make informed choices
Absolutely.
and to take charge of our health.
Couldn't have said it better myself.
So one last thought for you all out there listening.
Okay.
Knowing all this about heart health now,
Mm.
what's one small change you can make today to take care of your heart?
Maybe it's walk after dinner or trying a new veggie.
Ooh, good one. Or even just taking a few minutes to relax and de-stress.
Those are great ideas. Every little bit counts, right?
Absolutely, it all adds up.
And hey, maybe that one small change today will lead to a healthier tomorrow.
Here's to a healthy future.
Cheers to that. Thanks for joining us on this deep dive into heart health and aging.
It was my pleasure.
We hope you feel empowered to take charge of your own heart health journey.
That's what we want.
Until next time, take care of yourselves and those amazing hearts of yours.
See you next time.